There you go.
Today's topic is natural remedies for common ailments. Our guest speaker is Jessica Joslyn of Meadowpath Medicine, certified physician assistant. So please welcome Jessica.
Thank you for having me. So I'm Jessica, and we'll get started. Hopefully this doesn't turn out to be too lectury and isn't too boring. So I just stole the foundations of health from Dr. Forsman because it's kind of, what are the foundations of being healthy? Kind of where does this all begin? So pretty much think most people should spend an hour with some kind of stress reduction, management of relationships, career, hobbies, spirituality, meditation. And it doesn't mean you need to spend 1 hour at once. It might be 5 minutes here, 30 seconds there to calm down after the guy cut you off, or whatever it may be, but about an hour a day. An hour of nutrition, eating good food for you. That's important. I mean, eating twice a day may take 30 minutes. There's your hour. Self-awareness, eating awareness, knowing what you're eating. Don't do the absent-minded, popcorn on the couch and you go through a bag of popcorn or a gallon of ice cream. Most of the time we believe that primal principles, eating real food, organic food, pretty much no grains, no beans, that may be a plus or minus depending on indigenously where people come from. Beans can really stop the whole plumbing up, gum up the system. So sometimes those can be very inflammatory and bad. Minimal sugars, no preservatives, no chemicals. And one of the questions that ends up being asked is, I'm sick, can't I just go to the supplement shop and buy something and get better? And sometimes that works, but if we don't have a functional medicine lifestyle, a lot of the supplements and natural remedies don't work because the system is too gummed up with normal toxins and everyday stuff. But when we do more of a functional medicine kind of lifestyle, supplements work really well in those folks. Play and feel better, have a positive mind, a positive outlook, and a positive outcome will be there. 1 hour of some kind of activity, yoga and stretching tend to be my go-tos because most people can do them. And a good, long, sturdy stretch can actually strengthen your bones. Aerobic, resistance fitness, these tend to be the better ones. It's different for everybody. Whatever exercise you will do is probably the right exercise. If I told everybody to go jump on a trampoline and everybody broke their hip, that would be the worst advice ever. Whatever exercise you'll do, whatever body movement you'll do is the right one. We have what we call a basic nutritional protocol, or BNP, and that's every day. Most people should be taking a multivitamin, fish oils, great anti-inflammatory, approximately 2,000 milligrams a day. Vitamin D, about 4,000. Most of our patients actually take 5,000 to 9,000, and that tends to put them right where their labs are in the right sweet spot. Prevents illness, strengthens bones, help with hormones, all that stuff. Most patients are on a probiotic. I recommend with lactobacillus and bifidobacterium. Covers your large gut and your small gut. So it's just an oversimplification, a minimum of 20 billion colony-forming units per pill, a multi-strain. More strains does not mean it's better. So when you go into Whole Foods and you pick up something that has 15 strains, that doesn't mean it's better. It might have a drop of each strain, which equates to a whole lot of nothing. Rotate your probiotics for wellness. As soon as your body gets used to what you're taking, it doesn't work anymore. And it's not that. We just acclimate. We're humans of adaptation. We're creatures of adaptation. This is our antioxidant cocktail. Well, why would we need that with a toxic world? We basically add this to your basic nutritional protocol while under significant stress, and that can be emotional, physical, mental, whatever the case may be. Vitamin C, 1,000 milligrams twice a day. Vitamin E of the mixed tocopherols, because there's two kinds of vitamin E. These are together. And it's just one daily, and then alpha lipoic acid, which helps with detoxification. It's a brilliant antioxidant. And then when you get radiation, we have some homeopathy that we like to use called Radinex, and it helps the cells kick out any radiation so it's not lingering in the body. There tends to be somewhat of a worry about over radiation with folks. So say somebody's going in to get an MRI of something, we'll have them start this the day of their MRI and take it for 3 more days. I know that your handouts are written really small, but this will be reposted so you guys can rewrite it or whatever. So cold and flu season, that's right now. There are a lot of things that you can try, and for some people, you have to try different things to figure out what's the one thing that works. For most people, it's a handful of this and that. Eat real food, lots and lots of broths during this season when you're sick. Root vegetables, root vegetable crackers, chips, that can be kind of a good thing. And if you have to, if you've got the flu and you're reaching for that thing to sop things up, a gluten-free cracker. I'm guilty of when it's the flu season, I'm reaching for ginger ale and saltines. I mean, sometimes we gotta go off of our diet part, but I'm reaching for these things. So anyway, antiviral cocktail. Everybody around you starts getting the cold. You start getting the sniffle. Start this right away. Vitamin D, 50,000 units. 1 pill, 2 or 3 times a day, 3 days only. This is a large dose, boosts up your immune system, antiviral, but you can only use it for 3 days safely. Yes, people have used that amount and not had any problems, but knock on wood, you might be the person who has an issue, so 3 days only. Vitamin C, antioxidant to help kick out all the bugs, and that's 1,000 milligrams 2 to 3 times a day. Viracid is our antiviral caplet, and it's 1 to 2 pills every 4 to 6 hours. The sicker you are, the more likely you need 2. If you're in an office or here and somebody across the room is sniffling, you may just need 1. But if you're gonna go around a bunch of kids and they're all sick, probably need 2 to boost up your immune system, because kids, they got good germs. Quintins and Notisens I really like a lot because they're homeopathy. The 2 together are what we would call a viral remediator. So they help kick out what's left over from the bacteria or viruses that are dying. It helps to calm the immune response so you don't get this over robust immune response after being sick. Half of our sickness is the inflammatory responses that are started that need to be remediated. Antiviral cocktail for the flu can be kind of hard to get down because you've got the flu. But Quintins and Notisens, you'll see right there again. 1 squirt of each of them twice a day, viral remediator. And also it's kind of salty, so it doesn't taste bad, and it's easy to just kind of puts in your mouth and it's gone right away. Glutagenics is a glutamine, an aloe, and a licorice powder that helps to ease stomach acid. Irritable tummy, when you've got diarrhea, it helps to calm that down. The glutamine in it actually heals the gut and heals the stomach. So great for heartburn, great for people who've got hiatal hernia and have always got the burn going up. Very soothing for if you're just not able to hold anything down, even water. You want to get a little bit down and you can sip on it. You can put ice in it and it tastes decent and good, and you sip on it, it can be very soothing. This one is funny. It's called Kung Flu Fighter because they used to call it Kung Fu Fighter and then they got in trouble for copyright. But this is an herb which can be kind of hard when you've got the flu. However, you can put it in water. Comes in a little pump and you do from 3 to 6 pumps, and you can repeat it up to 4 times every few hours. So that just kind of gets rid of the symptoms. Does have some antiviral properties in it to help kick out the flu a little bit quicker. But it's very herby. Vitamin D, 50,000 units, 1 to 3 times a day is tolerated. And Mo Beta Belly I love because it is a pump, and so you can use as little or as much as you like. You can repeat as needed, and you can repeat several times a day. This helps with cramping of the guts. It helps with nausea. It even helps when you've got an anxious belly, helps to calm that down. Doesn't get rid of the anxiety, but it sure helps you feel better. All right, more stuff, cold and flu season. Oh, that's the same stuff. There we go. So fever and swollen lymph nodes tend to be a big issue, and my favorite thing to get rid of that is actually homeopathy. We have a cream that you can rub up the back of the neck, across the shoulders, and even at the bottom of the neck, depending on how bad a fever is. And that can prevent a fever from going from the body into the brain. So you've got a headache, probably have a little fever up there. It's a good one to put there. Iteries also comes in drops, and this kind of homeopathy cannot be used with metal. You just pour it into some water. You could do it straight into your mouth, but it tastes like whiskey, and that doesn't taste good. But if you put it in water, you can drink it. People have been known to put it in a bottle and drink it throughout the day. I'm kind of a, drink it all in one shot kind of person. But the Arthritis works at the whole body at getting rid of the swollen lymph nodes almost anywhere in the body. Apo-Infect is another homeopathy, and it's 20 to 30 drops in water 2 to 3 times a day. Helps to remediate the infection itself, not so much the inflammatory component, but the infection. Turmeric, if you can tolerate turmeric when you've got a flu, it's a good anti-inflammatory. Cold can be very helpful at keeping the fever down. And I did put Advil or ibuprofen just because when you're really sick, sometimes you have to evaluate, is this inflammation or is this infection? And so when you get to the point where turmeric isn't working and you've got a fever, choose Advil and do 200 to 600 milligrams, get that fever down. A little bit of a fever is good. You want to burn off some of the bacteria and viruses, but you don't need to be brewing at 102 for hours on end. Just a little fever, okay? The other thing, I put Advil up here, or ibuprofen, is when you're ill, if you have a reason, if you can avoid taking Tylenol, that is a good thing because your cells make an antioxidant that kicks out everything called glutathione. And Tylenol depletes your liver of glutathione. When you're sick, you need to get rid of those viral and bacterial toxins, so you don't want to deplete of glutathione. So choose your Advils and ibuprofens. Yes.
Can you speak a little bit slower?
Yes.
Louder.
Yeah.
And then this closer to your mouth.
Okay.
Not too close. The exact microphone, not too close.
No, not too close.
Okay.
Just slower and louder.
All right. So this is another one called Get Over It. It's one of those tincture pumps. And that same thing, the idea is use a lot of it, get the symptoms under control, and then back off. So 3 to 6 pumps, you can repeat it every 5 minutes, up to 4 times, and then every couple of hours. Or when your symptoms come back, get over it. How funny. Remember that a fever can be good. Drinks with ice chips can be very helpful, cool baths, things of that nature. Arthritic pain, who doesn't have arthritic pain? Is that loud enough now? Yeah.
Okay, so with the handouts, I realize that it's really small and there's a lot of information here, but don't worry, we'll send you an email with the PowerPoint. Okay, so you can get all of this information because I just picked it up in the bed and I okay, so.
Sorry, it's so small. It's the best I could do.
Thank you.
Yeah. So arthritic pain, this can be dealt with by many modalities, and I try to hit like supplements and any homeopathy and things that you can do or techniques that you can get into your lifestyle to help with this. Joint pain that's arthritic in nature can respond to many things. Just because something works for your friend doesn't mean it'll work for you, but most of this stuff is pretty safe, so it's worth trying. Turmeric, we like turmeric with Mariva, has good bioavailability. 1 to 2,000 milligrams is typically the starting dose. If somebody's got a huge swollen joint, I'll go up to even 4,000 milligrams to get that swelling down. And you can repeat your turmeric dosing to keep that swelling down or the pain down. Maintenance dose, we have patients who take between 1 to 2 twice a day with meals and see if they get that level of pain under control. CBD with or without THC can be very beneficial, whether it's in a salve that you rub over a joint or over your neck or wherever the pain may be. Getting droppers, they come in pills. There's so many different things. There's always the question of, well, is this real? Is it a good product? That is, for a different discussion. However, if there's ever a concern of, is it organic? Was it planted in organic grass or dirt or whatever the case may be? There's always the flower, and you guys can grow it yourself. You can actually get the flower so you see what's in it and you're not worried about, okay, well, they said that this cookie they're giving me is sugar-free. Is it really? You can actually take the raw ingredients and make your own. anyways, the CBD works up higher up the pathways that's stopping pain and inflammation than Tylenol and Advil do. It works almost as good as a steroid. So a very good anti-inflammatory, God's own medicine. Nerve pain. So I like to add frankincense to nerve pain. If you've got sciatic pain, you can put it right on your bones. You can drive it down where your nerve pain is. You've got nerve pain on your finger, nerve pain in your face, you've got shingles. You can put that right on the lesions to help get rid of the nerve pain. It is a quick treatment, so acute and quick. It's not a good chronic treatment. I saw your hand. And ginger, you can actually get frankincense and ginger with a turmeric, which makes it work in the nerves much better.
Oh, I thought you were talking about making your own. I was going to ask if frankincense is an essential oil.
Essential oil, yeah.
So could you make your own essential oil plus raw ginger?
Yeah, you could. Yep. This one was specifically to put with the inflavonoid intensive care, or you can add frankincense oil to the joint. You can get frankincense and ginger oil. It's very, very hot. So you may need to put it in a coconut oil or a carrier oil like jojoba so that it'll rub better and not be so hot on the skin.
All these things you're bringing, where do you get all this stuff? All the,
Like where do I purchase it or where do I get the information?
Not the information, the product.
Well, most of this stuff you can actually get at our supplement shop. I wouldn't recommend getting them online at Amazon because you never know what you're gonna get, but you could theoretically do that. Essential oils are sold at many stores. Even the pharmacies have them now. People sell them as mid-level marketing things, so those are easy to get. I tried to be not too name brand specific, so if people wanted to go to Vitamin Shop or Whole Foods or whatever, they could take this information and get that there too.
I've never heard of a lot of these products.
Yeah, no, there's a lot up there. Sorry, they're written so small. GABA is a neurotransmitter that helps relieve pain and decrease pain messages. And this GABA comes in a myriad of doses. I would say start low, slowly go up. GABA can be tolerated at very, very, very high doses. There's a prescription called gabapentin that's a very good medicine for nerves. These are basically like two molecules off of each other. Gabapentin is one of the least chemically tainted prescriptions there is. Systemic enzymes. These are an unusual way to get rid of arthritic pain because it is an enzyme that eats up inflammation. So your joint is there, it's swollen, you can feel the inflammation, and the Vitalzyme goes in there and eats it. It does not eat healthy tissue, it doesn't harm you, but it also can eat blood clots. Pretty amazing stuff. So it is in a pill form, yep. You can get, Vitalzyme comes in a little gel cap, Lambrokinase comes in a little caplet that's powder.
So those brand names or is that?
Those are brand names.
Okay. So where could you find those kinds of?
Lambrokinase you can get at almost any health food store. Vitalzyme you can get at a health food store, but with the XE is a professional brand, so that would have to be from a doctor's office, or our supplement shop has it too. My story about the systemic enzymes is the story about a butterfly. So you've got this nice little caterpillar and it eats all the leaves and goes into a cocoon, and then so many months later emerges as a butterfly. What it releases is serapeptase, which is what Lambrokinase and Vitalzyme are made out of. So it releases this serapeptase. Serapeptase eats the cocoon, destroys it, dissolves it, and this beautiful, delicate butterfly comes out. So Chinese medicine realized this 5,000 years ago. Holy cow, this eats up dead tissue, and it's been used for cardiovascular stuff ever since. It's used in the hospital. You go in for a stroke, they give you TPA. That is serapeptase. Came from this idea. Something in modern medicine that came from alternative medicine. It's TPA. The reason I put these two specifically is because Vitalzyme is the Rolls-Royce of anti-inflammatory systemic enzymes. Lambrokinase is kind of like your Infinity or your Acura, works really well. There are plenty of other ones. There are some that are sold at health food stores with a myriad of other ingredients in there. One thing to consider is this eats up things. If it's got 20 ingredients in there, it's probably eating all those ingredients. So that's why I was very specific with these two, because they don't have any other ingredients in there, nothing to inhibit their effectiveness. Oh gosh, more arthritic pain. Anybody got more pain? Tea relief gel and cream comes in pills. This is a homeopathy. The gel penetrates deeper because of the alcohol that's in there. I like the cream because it stays on the skin for longer, and alcohol tends to irritate my skin personally. The pills can be used for arthritic pain. It can also be used for headaches, and it's a homeopathy with some arnica and just ameliorates arthritic pain. I am a fan of German homeopathy. And Inflammar is a great German homeopathy. It comes in a cream, and you apply that to the joints. You can put something called Zellulicin on that, and that works like a DMSO, driving the Inflammar in deeper. So into your big joints like your knees, into your shoulder, into your hip, things like that. The two together work really very well together. These used to be a prescription, but due to federal regulations, they're no longer a prescription. But I think we're one of the only places that you can find that. Sombra, you can get almost anywhere. It's just a little gel that you put on your muscles, and it gets very hot and it relaxes the muscles. So more for muscle aches. It can work really well for plantar fasciitis, especially if you put it on before you go to bed. Magnesium glycinate, there's lots of magnesiums. Magnesium glycinate works best on muscles and relaxing muscles. Doesn't always cause the increased bowel movements, but glycinate is the one that we typically use for muscle pain. Myocalm, Myocalm Plus, and Myosedate. There's different name brands, but this is our herbal muscle relaxer. The Plus and the Sedate are actually for nighttime, because sometimes you have pain all day and muscle spasms all day and all night. You want to be able to have a muscle relaxer that you can use during the day and be able to golf, go to work, or whatever the case may be. And then always remember rice. Even though I practice alternative medicine, this comes in handy. So rest, ice, compression, so kind of wrapping things up, putting a little bit of pressure, not squeezing the heck out of a joint, but a little pressure. And elevation, getting that joint up so that the blood flow drains out of it and not into it. Part of the reason your foot swells so bad when you stub your toe is because gravity has brought all of that blood to the bottom. In arthritis, physical activity is king. The second we stop moving, arthritis takes over and inflammation starts to get worse and worse and start to spiral. We want to continue moving, because if we don't, we're going to end up like the Tin Man and really need some lubricating of our joints. Figuring out what physical activity you like, that feels comfortable, that you can do without getting hurt is really important. Just because I like yoga and think that works for me because I have a pain syndrome may not be the right thing for you guys. Maybe something with more of a resistance training, not hard, to build up your bones might be the right one. For some people, it's simply walking and getting their arms moving. Whatever the case may be, what works for you, but keep moving. Consistency and form are the most important thing. The weekend warrior who goes out on Saturday mornings, even though he's going out every Saturday morning, it's not consistent enough to keep those joints lubricated. And sometimes it's the form that we're doing things. You know, if I pick this up and I'm just kind of sloppily going like this, you know, there's no form there, there's no muscle building. But I can take this very light thing and actually turn that into an exercise. And with proper form, build up my shoulder and make that stronger instead of weaker. And all this is like, weighs nothing. So. The best anti-inflammatory diet is primal. So I didn't mean to harp on diet, but that was one of the things that Cindy was mentioning. If there was a specific diet for a certain disorder or ailment. So primal, again, is just thinking simple things that you can grab and pick up. No grains, real food, vegetables, minimally processed. For some people with arthritic conditions, their sugars, their sweet and lows, their chemical foods, their, TV dinner, all those things might be keeping inflammation in their body. And it's not like you stop it for a week and you feel better. If you cleanse your body from this stuff, stop it for a great deal of time, let the body get rid of it, then those things are down. And then people bring them back into their diet and they really go, holy cow, my joints are swollen. Or the next day, oh my gosh, I could hardly get out of bed. But when we're eating the standard American diet every single day, we're never going to notice that something in our food may be holding the inflammation in our joints for a longer period of time than it needs to be there. Am I boring you guys yet? I love a cold laser therapy. If we could find somebody who's got one and uses it frequently and it was cheap enough, that would be great. These you can actually get on Amazon and they're fine, and it's just a laser that's cold and you can put it over a joint and it increases blood flow, which helps to fix inflammation. Sometimes when you just increase the healing, the joint stops hurting. So for those ladies who on Christmas Eve or New Year's Eve had to wear heels, a cold laser treatment the next day when your knee was hurting or ankle, best treatment ever. You usually need one treatment and you're out the door. That we don't have at our office.
The cold laser, is that near infrared?
Yeah, it's like a near infrared. Near infrared.
That's what the cold laser is?
Yeah, it's called a cold laser though.
And heat's not good.
Heat can be good, but what you want to do with arthritic pain is you want to stop the inflammation with cold, compress the joint so that there's less flowage, and about 20 minutes after you've taken the ice off, you can heat that joint up so that it starts moving. But you don't want to start with heat because it just increases the inflammation. So ice first, take a break, and then use heat.
What about comfrey?
Nothing wrong with comfrey. If it works, try it.
Is that more for like an injury, or does it help in like?
Yeah, injury and bruising for most people will use that. We don't tend to use it in our office very much because we haven't seen a majority of people benefit from that, so we don't carry it in the office. But I've had patients who swear by it. Whoops. Oh, wait. Oh, headaches and migraines. So this is another one where diet and lifestyle are really important. Avoiding trigger foods, often chemicals, food intolerances, tannins from wine, cheap chocolate. Paleo is an anti-inflammatory diet that works really well for migraineurs and people who have chronic headaches or frequent headaches. Some people will notice that, oh my gosh, every time I eat top ramen, I get a migraine. It's probably the MSG. Some people will know, oh gosh, when I go to this winery, I get a headache. And when I go to that winery, I don't. It's probably a tannin at the winery. Sounds like a basketball game.
Oh, I can hear that was going on.
Oh, tannins. So if you get a headache after a winery, it's because of a tannin in the wine. And so avoiding those kinds of things and being very observant of which foods are triggering or which chemicals are triggering. And sometimes it takes a little bit of work to figure that out. Turmeric with Mariva, I like in flavonoid intensive care because of the ginger and the frankincense that's in there can really help bring down a migraine. The problem with a migraine is it's more of a vascular issue. Blood leaks out and irritates the nerves. That's why frankincense works. A headache is a headache, just your head hurts. Migraine frankincense oil, you can just get straight frankincense oil, put it on your thumb, and you can rub it on the hard palate inside your mouth. Don't suck your thumb, just rub your palate. And you can do that almost every 15 minutes to decrease the symptoms of a headache. If you have to take a medication for a migraine, this is a great way to slow down that chain event that leads you to having the weird body, the weird sensation, and sometimes nausea and vomiting, especially while you're waiting for that medication to work. For the most part, prescriptions are used to halt a migraine, and they are used at the very first sign of your migraine. If you have migraines, you know how bad it is. And if you know it's a migraine, it's not going to go away. And if you take your medicine too late, it's not going to work. The problem is that if you miss that window, some of the other natural alternatives are only going to mitigate a little bit of that pain. They're not going to be able to resolve it. Time is what resolves that. So for those migraineurs, if you need to take a medication, take a medication. Otherwise, try these things at the first sign of it. Get on top of it so it doesn't get out of control. Butterbur, PA-free, is very good at preventing migraines. I've had patients tell me that Butterbur can get rid of a headache, but using Butterbur consistently, even in studies up to 12 weeks, has shown that there's a decrease in migraine frequency, how long it lasts, and the pain of it. That's good. Feverfew, riboflavin, CoQ10, and magnesium glycinate also can be very good at prevention of headaches and migraines. The CoQ10 and the riboflavin and the magnesium actually have to do with part of a detoxification pathway, pathways to remove toxin. So toxin can cause headaches, so that's how those guys can help. Oops, I think that's the wrong way. Nope. Mind and body approaches are best for headaches. Most headaches have a component of tension involved. Migraines, massage can work really well for that component. Turmeric in a lipophilic form, so turmeric with Mariva can be very good for headaches. And Vitalzyme, especially in pregnancy or people who cannot take turmeric or Advil or Tylenol for whatever reason, Vitalzyme can help to ameliorate a headache too. In fact, for months, almost 9 months while our nurse was with us and pregnant, that was all that we could give her for her back pain and her headaches.
So the last one, is that okay for people that take blood thinners?
Sometimes the Vitalzyme is not okay for people that take blood thinners because it can't, and it depends on what it is. So it doesn't necessarily, it's going to eat the thickening of the blood, and if your blood is too thin, it will make it thinner. It will be reversible, unlike some of the blood thinning medications, but the Vitalzyme, you have to be very careful, and most people maybe need a quarter of the dose to half of a dose if they're on a blood thinner. Some people have to avoid it altogether though, depending on what's going on. So if you are likely to have a lot of transient ischemic attacks or blood vessels rupture and break really easy, that's not your go-to, not Vitalzyme, unless you're being supervised by a doctor and we're watching all these things. Lipophilic means fat-loving. So this just means that the medication, the turmeric, is coming in a fatty molecule, and that helps to bring the turmeric from the intestines into the bloodstream so that it can be active wherever you're having the arthritis. The thought is without this fatty membrane around the medication, it doesn't get into the cells as well. It stays in the intestines. Right. If you go to your local farmer's market and you, unless you're using a ton of it every single day with every meal. However, if you get it in a fatty membrane, I've heard of people taking it, putting it in a smoothie with coconut oil, and that they're able to get benefit that way. So I'm not going to swear by that one, and I don't recommend it to patients.